Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 153,125 confirmed cases of COVID-19 in Canada and 49,831 cases in Ontario. Chatham-Kent has 368 cases and Sarnia-Lambton has reported 346 cases. Michigan now has 121,427 cases, with 14,358 cases being in Detroit. Today, we are reporting a total of 2,652 cases of COVID-19 since March, an increase of 3 cases from yesterday. All 3 cases are being investigated at this time. 2,510 cases are resolved and 66 cases are active and being followed by our health unit. 4 people are in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There is 1 retirement home currently experiencing a COVID-19 outbreak. With return to school, parents are reminded to conduct daily symptom checks before sending their child to school. Parents are encouraged to use the ministry's assessment tool, which can be accessed through our website or at ontario.ca. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. New provincial guidance on testing states low-risk, asymptomatic individuals should not be considered for testing. For people with at least 1 symptom of COVID, testing should be considered. Windsor-Essex has 3 assessment and testing centres, including St. Clair College Sportsplex, Windsor Regional Hospital Ouellette Campus, Erie Shores Healthcare in Leamington, and SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Due to the quick access online, you may receive your results before the health unit contacts you. Please continue to visit our website at wechu.org for further information. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with CBC.
Good morning, Teresa. So we had some new restrictions come down from the province over the weekend, and CBC, we're hearing some complaints from restaurant owners about behavior on patios. Were there more inspectors out this weekend since the new rules tightened?
We did have people out on the weekend. I'm not aware of the infractions or the results of the the interactions on the weekend, but we continue to have our staff out in the public. Like, that has never let up, but they were working on the weekend.
But no numbers on any infractions or any violations that were handed out?
I don't have those numbers this morning. Sorry.
No problem. Okay, thank you.
Any questions from AM 800?
Teresa, since Friday, has the health unit been receiving calls from businesses that are impacted by these new measures? Are many asking questions? Are they concerned with these new measures?
We still have like a call center, so we do have calls coming in and questions, clarification, but I don't think that people aren't clear about the restrictions. If they have questions, they do call us, but it's not that they're not clear about what the guidance is. So I'll continue to look at what kind of questions we have, and maybe tomorrow I can give an update, but we do continue to get a lot of questions, but again, the most frequent concern brought forward to us is patio distancing and people not wearing their mask properly.
Teresa, since these restrictions have been put in place, I know locally it's been education, but looking at other areas, I know Toronto Public Health shut down a few establishments. Some charges, fines have been issued. Since these have been implemented, has anything changed in Windsor-Essex? Has any fines or charges been laid yet?
No, not to my knowledge. That we haven't had any fines or anything further regarding these, non-compliance. Like what Toronto has experienced, that hasn't happened here.
Okay, thank you.
Any questions from the Windsor Star?
Not at the moment, thank you.
Any questions from Windsor?
Good morning, Teresa. I know a while back the health unit approved the new position for an associate medical officer of health. I was just wondering how that hiring process is going.
Well, we haven't been able to successfully recruit an associate medical officer of health, but the search continues. We do feel that a health unit, with the size of our health unit, that it would be beneficial, but so far we have not been successful in that recruitment.
Okay, thank you.
Any further questions from CBC?
No, thank you.
AMA 100?
Sure, I just have one. Teresa, if someone tests positive for COVID, and then after they're isolated for 14 days, and if they have no symptoms, do they have to get retested, or does the nurse or their doctor, whoever they're dealing with the health unit, do they give them the green light, or does this individual have to get retested?
So the question would be a positive person that is in isolation for 14 days, I'm assuming. So every case is a little bit different, but typically if someone's tested positive, they're to remain in isolation since the onset of their symptoms or the positive test, and then they're cleared by our health unit. So that clearance does come through our nurses, through the direction from the health unit, and that's how it's done. There's no negative test that's a requirement through our health unit at all.
Okay, thank you.
Any further questions from the Windsor Star?
No, thank you.
Windsor?
No, thanks.
Thank you, everyone.